Hello friends, welcome to Shri Nitralay. In this case of soft cataract, we are going to see step by step phaco emulsification, PC polishing and few more minor tips for each step. So let's start. Main port entry is 2.6 mm and a side port is 23 gauge. AC is filled with optimal amount of viscoelastic and a rhexis marker of 5.5 mm is used to guide rhexis. A radial cut is given in the anterior capsule in the center and it is converted in a curvilinear fashion to make a circular rhexis. You can note there is hardly any pressure on the anterior cortex which is not getting disturbed while performing CCC. After lifting a flap of anterior capsule, a 27 gauge cannula is used to hydrodissect and hydrodelineate the nucleus and cortex. Nucleus is rotated in the back to free all fibers from the capsule. Once the nucleus is free, it is easier to manipulate while performing phaco emulsification. Anterior chamber is filled with viscoelastic and phaco emulsification started. First, I would like to take my phaco pedal to position 2, that is IA mode, which will remove the cortical material from all around 360 degree. It will make nucleus free in the back, so manuous following becomes easy. While taking out the nucleus, please note I am holding the nucleus, tilting it and chopping. So hold, tilt and chop. In soft cataracts, I need not to divide it into 4 pieces and then take out. In softer cataracts, you can start emulsification once the piece is divided into 2 pieces and no further division may be required if you have enough room for manuals. Start IA from subincisional location. A curved tip helps a lot in such scenarios. Note the circumferential movement of IA probe, and once the bore of aspiration is occluded, you can pull the cortex into the center. This way cortex can be taken within seconds. Here I am using a Coach Singer polisher for capsule polishing. Capsule polishing helps you in preventing anterior capsule phimosis, decreases the chances for PCO, decreases the chances for IOL decentration because of phimosis, and specifically useful in pediatric and younger cases. This makes your surgery perfect. If you are scared to enter with this instrument with bare PC, we can implant IOL and then perform a capsular polishing. That is also a good alternative. You can note the capsule fibers are seen as dark shadows against fundal glow. AC is formed with viscoelastic. A blunt tip IOL dialer is used to dial the IOL into the bag with the left hand. Notice this will push the IOL directly into the bag without any delay. This is very important where the IOL memory is low. This step ensures that IOL is dialed into the bag completely without any issues. As in cases with small pupil and floppy iris, you do not see a CCC margin and it may be difficult to identify whether your one haptic has gone into the sulcus or in the bag. So it is always good idea to dial it into the bag immediately. To confirm, you can rotate the IOL in the bag and check it. Viscoelastic is washed with IA probe with high vacuum and specifically from angles and from behind the IOL. Hydro is performed and anterior chamber is formed with BSS. Intracameral antibiotic can be injected as needed. Hope this case will be a good guide to the beginner surgeons. Do subscribe to YouTube channel Dr. Pankaj Landai for more such videos. Good day.